Welcome back to Live Now from Fox. We showed you this poll just a little bit ago. Do you like daylight saving time? A lot of you said no, you do not. And many Americans do not because it can mess with your body. The good news is, though, you'll get an extra hour of sleep. But the bad is it'll be dark by later afternoon for the next few months in the U.S. Daylight saving time ends at 2 a.m. local time on Sunday, so you should set your clock back an hour before you go to bed. But the time changes can be hard on your body. Many Americans, as we just saw with our Live Now from Fox poll, actually prefer to get rid of daylight saving time entirely. And some health groups, including the American Medical Association and the American Academy of Sleep Medicine, have agreed in getting rid of the time switches. Let's bring in Dr. Fahmi Farah. She's a cardiologist, and she's going to help tell us how we can adjust better to this time change, as well as the effects it has on our bodies. Thanks for joining us this morning.
Thanks for having me.
All right, so first of all, how does daylight saving time affect our bodies? And can you talk about the role sunlight plays?
Daylight saving time can impact our bodies in a number of ways, your cardiovascular health as well, because, sleep is so important and it is now a major risk factor for cardiovascular disease. So when we're losing that 1 hour of sleep, or, in this case, we're gaining, but either way, it's a disruption. And that disruption can throw off our circadian rhythm, and sleep can be really impacted by that. And that can cause our blood pressure to go up, our heart rate to go up, and all of that can have a major impact in your overall cardiovascular health.
Right. So can that increase your chance of a heart attack or a stroke? Is something like this really that serious?
In the acute setting, in some cases, yes. For instance, if somebody's super stressed out because of that schedule adjustment, these are minor changes, but different people can have different impact from it. And so it's not to say that everybody's going to go have a heart attack, but is there a risk factor for that? And the answer to that would be yes.
So then how can we reset our circadian rhythm? How can we make this a little bit easier on ourselves as we switch this weekend?
Exactly. So as you go into this weekend, my advice would be to prepare for this a little bit ahead of time, like 2 or 3 days beforehand. Try to make that adjustment in like increments of 15 to 20 minutes of your bedtime, so that when the time comes, your circadian rhythm is not completely thrown off, so your body feels the impact less. So all those risk factors that we're just talking about, those are very much preventable by making that adjustment.
Are there any symptoms to look out for when people switch? I mean, obviously being tired, but we know sleep, as you just said, plays such a big role in our lives. What else should people look out for?
Making sure that you're not deviating from your routine. Because of that 1 hour adjustment, people, for example, who are on medications, make sure that you're taking your medication, making that adjustment on time, that you're still going to the gym and you're eating healthy, stress management. All of those are going to be pretty important in this scenario.
Great. Doctor, is there anything else that you can recommend for us so that we can really get back in the rhythm and not be too disrupted by anything?
The biggest advice would be go into it preparing ahead of time. Start tonight, maybe make that adjustment and make sure that you're not stressing out, that this is just 1 hour difference. And if you mentally prepare yourself and physically take the time to prepare ahead of time, you will do just fine.
Awesome. Thank you so much for joining us today on Live Now from Fox. We greatly appreciate it.
Thank you for having me.
Of course.